Hey there, fellow YouTube enthusiasts. Today, we are diving into a topic that's both relatable and surprisingly under-discussed, the phenomenon of period poops. Now, I know what you're thinking, and no, it's not just a myth. This is a real thing that affects a significant portion of the female population, and it's high time we shed some light on it. So, grab a seat, and let's unravel the mysteries behind this monthly gut-wrenching experience. First things first, let's talk about the stats. In a study, a staggering 73% of healthy premenopausal women reported significant gastrointestinal symptoms during their periods. Abdominal pain and diarrhea were the most common complaints, but nausea and constipation made an appearance too. Now, if that doesn't paint a picture, I don't know what does. And the interesting part. These symptoms often coincide with menstrual cramps, making it a double whammy for many. So, what's the deal with these period poops? Well, it all starts with the uterus. As your period approaches, estrogen and progesterone levels drop, signaling your body to break down the uterine lining. But here's the twist: during this process, cells in the uterus release hormone-like compounds called prostaglandins, which cause contractions in the muscles of the uterus and digestive tract. Now, here's where it gets a bit fuzzy, but the leading theory suggests that these prostaglandins enter the bloodstream and stimulate similar contractions in the gut, leading to the intestinal cramping and diarrhea we often experience. Now, here's where it gets even more fascinating. Some experts believe that the vagus nerve, which runs signals between the gut and the brain, might be involved. This nerve is highly sensitive to stress signals and inflammation, and when activated, it can provoke fluid release and increase muscle contractions in the gut, resulting in diarrhea. So, if you've ever wondered why you get an upset stomach when you're anxious, it might just be your body's way of telling you to chill out. But wait, there's more. Many women also report constipation 1 to 2 weeks before their periods start, which might be linked to high progesterone levels. However, the evidence on this is a bit patchy. Now, if you have irritable bowel syndrome or inflammatory bowel disease, you might experience significantly worse symptoms around your period, and those with endometriosis often carry a higher burden of gastrointestinal symptoms overall. But the good news is, you don't need an underlying diagnosis to have period poops. Now, the million-dollar question: can anything reduce these gut symptoms? Well, the answer is a bit of a mixed bag. Probiotics have shown some promise in improving indigestion, but not diarrhea. Oral contraceptives are theoretically effective, but there's no solid evidence to support their use for GI symptoms. Anti-inflammatory drugs like ibuprofen and naproxen can help, but they can also irritate the gut lining and cause diarrhea, so they're not a one-size-fits-all solution. And for those with Crohn's disease or ulcerative colitis, they can actually worsen symptoms and should be avoided. So, what's the practical solution? Diet, my friends. Staying hydrated and eating more fiber, like fruits, vegetables, whole grains, and legumes, can make a world of difference. Cutting back on greasy comfort foods can also help. Exercise can be beneficial for some, although the data aren't overwhelming. And if symptoms are severe enough to impact your daily life, it's definitely worth discussing with a doctor. Now, here's the thing: why haven't we found a solution to this common issue yet? Well, it's not for a lack of trying. A decade ago, researchers like Taylor Judkins, a nutrition researcher at the University of Florida, started studying period poops. But here's the catch: menstrual health has often been treated as a niche concern rather than the critical issue it is. When researchers don't study something, clinicians are less likely to treat it, and patients are less likely to raise it. But Judkins is hopeful that this is changing. She believes that funding for women's health research is ultimately a gain for everybody. So, there you have it, folks. Period poops are a real thing, and they're not just a myth. By understanding the science behind them, we can take steps to manage and alleviate these symptoms. And remember, if you're experiencing severe symptoms, it's always best to consult with a healthcare professional. Until next time, keep exploring, keep learning, and most importantly, keep your gut happy.